So a BBL isn't about just adding more fat. There's very different factors that go into making a successful BBL or performing a successful BBL surgery. So a BBL is a liposuction, normally of the torso with fat grafting to the buttocks and the hips. Depending on what you want, depends on how much fat you may need and also your own body habitus. So there's a lot of nuances and little details that make a successful or a great outcome for a BBL surgery. And so that's what I'm hoping to talk to you guys about in great detail, piece by piece. The secret for a great outcome in a BBL surgery isn't just about adding more fat. Like I said, there's lots of nuances that go into the detail to give you that great BBL outcome. So one of the first things I want to highlight is that the liposuction. The liposuction is the most key component of the BBL procedure because one, where are you getting that fat from to do the augmentation for the BBL? And two, that's where you do your sculpting. That is where the sculpting makes a big difference for your result. And it's all about where you're taking the fat from in terms of just putting the fat. Because anyone can just shoot fat into the buttocks. You have to do it correctly, you have to do it right, and there is some artistry to that, but I believe most of the artistry comes from the sculpting, the liposculpture, in doing your liposuction. So doing a very precise, well done liposuction is gonna be key to giving you that great BBL result. Because you may not even have a lot of fat. You may just have a little bit. You may want more of a natural look. By doing that liposuction the correct way, the precise way, you can almost make it seem like you've had a BBL result, a fat transfer, but all you've had is liposuction. And so that's what we strive, and that's what I strive to do, is make the liposuction the most important part of the BBL procedure, sculpting those different areas, especially those areas where you have stubborn fat that you've tried to work out in the gym and Ozempic hasn't gotten rid of, to give you that look you want to really bring that waist in or snatch that waist, also make your tummy as flat as possible, but also bring out your natural curves that are there, but are just hidden by those stubborn areas of fat. So the second thing, or the second insight that I would say is super important in trying to do a well-crafted or getting a great outcome in a BBL surgery, is where you're placing the fat. It's not about how much fat you're placing, but the key areas where you're placing those fat. First and foremost, we want to be super safe. So I'm assuming that people are taking into account that I use ultrasound to place the fat, because traditionally, back in the day, before there was ultrasound, or they were really mandating ultrasound, they were just placing the fat blindly. They were trying to put it on the muscle or even put it in the muscle. And then that's when issues were happening. That's what you don't want. You want to make sure that the surgeon you choose, hopefully it's me, but if not, is using an ultrasound device so they know exactly where that fat is being placed. Although you do have some fat loss because sometimes the fat doesn't have enough blood supply to grow, and so it gets absorbed by the body. That's why people were placing it in the muscle in the first place. But you place it in a certain distinct area of the buttocks, away from the muscle, away from the fascia, to really get that safe placement, so you don't have to worry about those tragic complications that you hear about the news and in social media. But back to the artistry. The artistry of the BBL is all about where you place that fat, not necessarily how much of the fat you're placing. So first and foremost, when I'm examining you, I'm looking at those hip dips. First and foremost, that's when what we call lateral depressions of the hips, and a lot of people don't like those. Some people love their hip dips. I think out of the hundreds of BBLs I've done, I've probably had at most 3 people, 2 people I can think of for sure, but at most 3 people that love their hip dips and they didn't want any fat in there. And I happily oblige, because it's your body, it's your expectation. I have no problem with it. But for those that do, first and foremost, I'm looking at the hip dips, and then we're looking at the projection. How is the projection on your body going? Because some people have a natural shelf. Some people have this fat pad that occurs right above their buttocks that they hate, that kind of gives their butt like an elongated look, a long look. That's also something I'm looking at. I'm looking at right at your gluteal fold, or what people like to call the cuff. Some people have a cuff, some people don't. And that's really defined about your natural anatomy. And that's a hard thing to recreate. But putting the fat in different places is going to give you a different outcome, because anyone can just put fat in there and be like, boom, yeah, it's a BBL, but is it a well done BBL? So you really got, that is where the artistry of the BBL comes into play. One is the liposculpture, like I said earlier, then two is where you're placing this fat. And of course, we're being safe about that in its totality, because what if you have a little ligament like at the bottom cuff of your buttocks, and then you put the fat in there, next thing you know, you wind up what people call chicken butt, or what I like to call a medial gluteal fold deformity, to try to make it a little bit more scientific sounding. So yeah, you definitely want to pay attention to where that fat is going, whether it's in those lateral depressions, aka the hip dips, or if you have that lower gluteal fold depression, also known as the chicken butt, we want to be careful with that as well. So it's all about where you place the fat. So another insight, talking about, gluteal fat grafting, also known as a BBL, is, the fat survival. So in different areas, the fat survives a little bit differently. I would say the worst area is those lateral depressions, or what we like to call the hip dips. One, the skin is very tight in that area, so trying to put fat in there, doing the fat grafting, is a little bit harder. And sometimes you're not going to get that, ballooning out, or that feeling of the depression, at least to the point where you would want it to be nice and voluptuous. Sometimes it requires multiple rounds to get more fat in there to fill that whole depression up, to give you those hips that you're looking for. But because of that skin is so tight, it's hard to put a lot of fat in there, and the body's already going to reabsorb a good amount of the fat that we place in there, because one, the blood supply is just not as good. So like I said, traditionally, earlier in the days, when people were doing these surgeries, they were putting the fat into the muscle because there was a blood supply for that fat to grow. But we know now, through recent literature and research, that putting fat in the muscle is the reason people were having these dreaded complications and, untimely deaths, because the fat was going into the circulatory system by low pressure veins and taking that fat to the heart and lungs. And that's what was causing people to pass away. And so that is a big no-no. That's why we use ultrasound, so we know exactly where we're putting that fat. But the vascular bed sometimes is not that well around the areas we're placing that fat, and so some fat gets reabsorbed. I would say close to 30 to 40%. I don't think there's like a true number, but that's roughly what most people say, that you're going to lose about a third of the fat we place, and probably more so in those hip dips, because like I said, that vascular bed is just not as good for that fat to grow, and you lose a lot of that fat on top of not being able to put a lot of fat in that area in the first place. Also sitting, some surgeons allow you to sit sooner than others. All that evidence is anecdotal, meaning there's no true study that has shown that pressure kills a lot of fat. But in our minds, it makes sense that if you're putting pressure on an area that just got fat grafted, those cells are going to be more sensitive. And so putting pressure there, you're going to cut off the blood supply or decrease the oxygenation of that blood going to those fat cells. So you lose a lot of those fat cells. So those are things that we're thinking about when we say, hey, no sitting, try not to put any pressure there, to maximize your fat take for that great result. And, also, nutrition comes into play. That's anecdotal as well, because if you stimulate those fat cells with, with whatever you're eating, I like to prescribe a high protein diet with healthy fats like avocado and things like that. But there's no true study saying that, hey, this actually works. But it makes sense, because if you eat a hamburger, you eat a hot dog, you eat something that's high in fat, or, you're going to stimulate those fat cells to grow, because they're going to take that fat in. So, it's just all cell biology at that point. So that's the third insight, that, you're going to lose some fat. That's inevitable. Some areas more than others. And then you also have to take in consideration, is this your second round? This is your third round BBL? The fat quality sometimes is not as good, because a lot of that, tissue that we get through the liposuction is scar tissue, from the previous liposuctions. The fat cells may be very small and not as hardy as the previous fat cells, because we were able to get more of those good cells in there to inject for the primary or the first round BBL. So yeah, you're coming in for a second round, but instead of losing 30 or 40% of that fat, you're probably going to lose close to half, maybe even more than half. But like I said, it's all anecdotal. There's no true study that has shown that just yet. But only from surgeon experience and going to conferences and talking to other surgeons, that's what we call anecdotal evidence that, hey, we've definitely noticed something. We just haven't been able to explain it in scientific terms and show research to go from there. So a common misconception that I really want to touch on is that more fat is going to be better. We kind of mentioned it earlier on in this talk, but I've had patients where their skin was so tight that we weren't able to put in a lot of fat to give them that dramatic look they were going for, that nice voluptuous curves. And I had to explain to that patient that, yeah, there is a cutoff that you want to reach, that you don't want to go past when you're placing the fat. If you're putting too much fat in there to the point that the skin is really tight and that the fat is squirting out of the actual incision that you're using to put the fat in, I believe that that buttocks has been, or that area has been overloaded, and that can lead to less fat survival because there's only so much blood supply for those fat cells to take, and that can cause either infection or it can cause fat necrosis, where you end up with these hard lumps of what we call necrotic or dead fat, and it doesn't soften, it just turns into a hard lump, and that's what I'm trying to prevent. So I had a patient recently where she didn't get the result that she wanted. She wanted something more dramatic, more voluptuous, and I wasn't able to tell her preoperatively, like, hey, like, I'm going to be able to deliver on this automatically. I tell no patient that because once I get in there and start injecting the fat, and that fat starts squirting back out, the skin is not stretching out, it's not giving us that look that we want. I can't keep pushing fat in there because I'm going to cause more harm than good. Like I said, infection, fat necrosis. You don't want these things because they're hard to treat at that point. It's easier to just stop, come back for another day, do another round, and hopefully get more of that skin to stretch out once everything is settled to kind of give you that look you're wanting. And also now we have the expectation like, hey, it's going to take a few rounds to get you that look that you're going for, that more voluptuous look, because your skin is just not giving us that, that laxity to be able to put more fat in there to give you the look you want. So just remember, more fat doesn't necessarily mean better. And sometimes it does take stages to kind of give you that voluptuous look. And I know you get, sold a dream on certain profiles, certain results. Some patients just have, a different body chemistry. Some patients just, already have natural curves and natural hips and their body can just take it. So no patient is alike. And so that's something we have to take in consideration. So at the end of the day, liposuction, BBL, or, gluteal fat grafting to the hips and the buttocks, if we want to be more proper with it, has an artistry to it, has some technicalities to it. And, you want to be judicious in who you choose as far as surgeon, do your research. You want to make sure that someone is safe, that has, outcomes on people that resemble your physique, I think is a very good telltale sign if that surgeon's the one for you, and someone that's going to answer all your questions and make you feel comfortable about the procedure. There is a very big artistry to doing a BBL, to getting the results that you want, and not everybody's going to be able to give you the exact results. And also, sometimes we are limited to your body makeup, your body chemistry, and during consultation, we should be able to point out a lot of those things to you. And then some things are just unknown. Like I said, going into the operating room and try to inject that fat, and now that fat is not really taken as much as we would want, but just you have to trust the process and knowing that, okay, we've reached our threshold here. Let's not push it because we don't want to cause a complication. So hopefully these tips or these insights have been beneficial. So when you choose a surgeon, hopefully me, but not necessarily me, that you are well informed in discussing the procedure with a future surgeon, and you get that result, that outcome that you're looking for, and that you share this video with other people that are potentially thinking about having a BBL or a Brazilian butt lift, also known as liposuction with fat transfer to the hip and buttocks. I'm Dr. Wilton Triggs. I'm here in sunny Miami, Florida. Of course, if you have any questions, further questions, or concerns or anything like that, I'll leave my contact information at the bottom, and my consultations are completely free.